Venture LLC. This week's special guest, David King of LabCorp. Now, Laurie Willis.
Hi, Anthony. Hello, John. Welcome to the program. Thanks for being here.
It's great to be here.
Thanks for having us.
Thanks. John, I love the name of your InnoVenture and the Swamp Fox group that you've created down in South Carolina to promote innovation and entrepreneurship in the Carolinas. Tell me a little bit about your group and what you're trying to accomplish with South Carolina.
I love how organizations work together.
Great, great. Speaking of new models, Anthony, let's switch over to you. Sure. You are a healthcare marketing expert and help healthcare companies figure out how to market in the new economy. So what kind of changes are you seeing in marketing of healthcare companies? How is it different marketing in 2009, 2010 than it was in 1979 or 1980?
Well, there's how is it different and maybe how it should be different, because a lot hasn't changed. I think there's still a lot of competition, still a lot of traditional media being used, and a lot of selling in some respects. And I think what has to change is the conversation, especially if at the end of healthcare reform you have more access and more people coming into the system. I think the conversation has to, because in theory, what would you need marketing for? I mean, you have the patients, right? You're supposed to drive patients, but I think it's going to switch more to education about how do you access the system. And I think marketing, at least in healthcare, and I particularly work in hospitals, so that's kind of my world, needs to be a little more strategic in understanding, you know, what services can we help our system bring to the table, whether it's virtual medicine, telemedicine. I mean, there's some great models out there, because there's going to, I believe anyway, there's going to be an access problem, and there's going to be more problems. How do you access the system when now so many more people are going to be able to get to it?
So if the marketing model becomes more of an education model, this is how you access the system, and that's what are the tactics that you use to go ahead and reach people and educate them on the new processes or new accessibility models that will exist?
Sure. And I think they're reaching the people now, but in different ways. I mean, especially in this market, there's a heck of a lot of television advertising. And again, I joke that you're marketing something people don't want. And that's kind of a basic premise of healthcare. You're marketing something who wants it, you know? But I think the mass media is going to have to stop, and you're going to have to look at, you know, where the conversations take place. And conversations take place a couple ways. Obviously, the internet, so social media is going to play a role. But also, word-of-mouth marketing strategies. How do you bring communities of people together? You know, how do you engage influencers? And I think those conversations have to start at a grassroots level to educate people about the healthcare system, proper use. I mean, there's some self-responsibility as well in the public that I think we haven't been used to talking about.
Let me throw this at you. If you, President Obama was in Raleigh last week, and he's trying to sell this national health care reform to the public, and the public's really not biting or not taking the bait. If you were his advisor and you're a consultant in this, what would you tell him to do?
Well, if I answer this call, will I get a call from somebody?
You might.
The biggest thing for me is that right now it's been a policy debate, and it hasn't really been a how does it affect me on a daily level? And it's also been about more concentration in the 50 million who are without, as opposed to the 250 million who have something. And in some ways, we carry our little card around and we show it, and there's a certain amount of entitlement there. There's also a certain amount of fear. And I think some of that is allaying the fears of the people who have coverage now. And what's going to happen? You know, are my taxes going to get higher? Is there going to be access problems? What's this public, system about? And less of a policy debate and some real-world examples, because I guess there's 3 or 4 main bills that are floating around. What does it mean to me on a daily basis in my life? How's it going to change? Because I think there's just, when you have fear, there's all kinds of misperceptions and then a lot of naysayers.
Do you see any new business models that can help drive down costs? Something that comes to mind is, the minute clinics like in a CVS, so I don't have to take my children to the family practitioner when they have sniffles. I can take them to a nurse practitioner. You see anything like that could really change healthcare? Well,
I mean, certainly the retail clinics haven't really taken on here, and I think hospitals kind of missed the boat on that one and actually developing themselves, but it comes down to really more convenience and access. Why did they flourish, and why are they flourishing in other parts? It's about convenience and access and the whole, what we call the patient experience. So I think, some of those models need to take place. So there's a great, there's a physician in Brooklyn, not to plug anybody, but his name's Jay Parkinson, and he has this model for, it's a virtual model of healthcare. You sign up, a physician does come and does, comes to your house, does a physical, and then you have virtual consults during the course of the year, and I think, the basic package, you sign up for a certain amount. Very affordable and very accessible, and I think those models are going to have to become more and more, because I think we're just going to see a flood into the healthcare system.
Does it also, the minute clinics and in the convenience stores, what do you think of the trend of in business clinics, basically a clinic at your office where your employees can go and they can get prescriptions and they can get treated? What do you see that trending?
Well, you would think it would trend more, because a lot of companies are self-insured, so dollar for dollar they're paying everything out of pocket based on the experience of the workforce and their illnesses. So you would think it would catch on more, but I think some of the models are, to bring an actual clinic or a whole fitness pavilion or things like that. Some people just think it's out of their reach. So I think it's more, how can you have some collaborations and partnerships with other people in the community? Instead of looking at it a fitness center, for example, it's more of a health and wellness center. How do you collaborate and look at those? But I think it should be looked at more, because, again, we're 37th in the World Health Organization, and some of it I blame on self-responsibility. We, as individuals, just don't take care of ourselves. So it has to start, and that's one place it can.
That is happening in South Carolina with Kent Manufacturing comes to mind.
Or getting less sick.
Anthony, what do you think about David's comment?
I think you're right. And the president went to the Cleveland Clinic for a reason, because the clinic has physicians, salaried physicians who, as I guess Toby Cosgrove said, he could perform 1,000 heart procedures or 10, but he's paid the same. And so that part of the equation, that's not an incentive for him. Doing the right thing is an incentive for him. So I think, the models are going to have to change. I mean, we look across the globe and you see what, physician salaries are across the world, and it's just a different paradigm than we have here. But, the physician salary model is certainly one that's being debated now as well in this whole thing, because Obama keeps going to a lot of institutions that have these models in place. So, and that's, because I equate it with, like, my mother worked in a tailor shop, and she got paid by the piece, everything she put together. And it's sort of the same in healthcare right now, which causes kind of the duplication and repetitiveness that we have.
Right. John, you have a question for David?
Well, kind of the same thing.
In which they're being treated whenever they feel like.
Anthony, did you have a question for David?
Yeah, just picking up on the EMR and electronic medical records. I mean, there seems to be a lot of competition in the space, and as long as there's competition, will we ever get to a point where people are using the same systems and these will all talk to each other? Because obviously, if I can, go cross country and go into a hospital, ideally, you'd like somebody to be able to pull your record up, but I just don't know the reality of that.
So, I'm not a great believer that the government should establish rules for a lot of things. But the one thing that as we talk about the government really making an investment in EMR, rather than spending money to buy EMRs for people, what the government could do that would be very productive is to set standards for what is in an EMR and how that data would be displayed. They did that.
Anthony, we've got time for a quick question.
Sure. This is maybe a little more out there, but I've done some work in medical tourism, people going overseas for health care, and we know that some testing goes overseas. You might have your CT scan read in Australia. Is globalization in your industry something that's an opportunity or a challenge?
I actually think globalization is an opportunity, particularly when it comes to pathology and tissue testing. But I think it'll be the other way. I think as one of the most interesting innovations we see coming down the road is digital pathology, where instead of reading tissue from a glass slide, we can actually look at it in 3 dimensions on a computer screen. When that happens,